Look at C1. There is no vertical body. There is no vertical body. There is posterior arch and anterior arch. Transverse, superior facet joint, inferior इसके नीचे रहेगा. And there is a small opening here. ये देखिए. There is a small opening here. That is transverse foramen or foramen transversarium. So this vertebra, this part, it articulates or forms joint with occipital condyles. C2. Again, C2 vertebra is totally unique. Why? Because from the body, vertebral body, there is a peg-like structure, dense, which goes into the spinal canal behind the anterior arch of the C1. Right? Now, coming to foramen transversarium. This is a specific feature of cervical vertebra to have a small opening in the transverse process. The content of first 6 vertebra, foramen transversarium, vertebral artery, vertebral vein, and sympathetic nerve plexus. And the foramen of C7, the vertebral artery is not there. It is not there. Just a line about C2 ganglion. It is very important when we perform surgical procedure. This is a dorsal root ganglion which sits between, which sits there. Between C1 and C2 level. Now, there are 3 main bones: occipital, foramen magnum, condyles, C1 that is atlas, and C2 that is axis. Right? So now, how these 3 bones are connected? They are connected with various joints. This in green, we have tried to show these are the occipital condyles. This is superior facet of C1. So this is a talento-occipital joint. This joint, this is AA joint, that is a talento-axial joint. That is a joint between C1 and C2. These are the various ligaments. I will not go into details. I welcome Dr. Solanki and Dr. Upinder. Thank you. Thanks for coming. These are the various ligaments. Principal stabilizing ligaments of CV junction. They are transverse atlantal ligament and ulnar ligament. Then there are so many secondary stabilizing ligaments of CV junction. Again, in a cut section, we have tried to show anterior talento-occipital membrane, posterior one, and talento-axial ligaments. So students, I will not go into details. We have given you the small booklet of the presentation. You can go through, because at this stage you will not understand about these various ligaments. Ligaments again, tectorial membrane, cruciate ligament, yes. Now, neural relationships in relation to CV junction. Medulla, proximal part of spinal cord, practically medullary spinal junction, lower cranial nerves 9, 10th, 11, 12, cervical cranial nerves, and a part of cerebellum. Important. This you must know because this is again a short note or a big question in your exams. Arterial relations. Whatever arteries, pica, that is a posterior and inferior cerebral artery, meningeal branches, posterior spinal artery and anterior. For the students, if I try to describe the vertebral artery, it is the first and the largest branch of first part of subclavian artery, right? And anatomically, we divide it into 4 segments. Segment 1, from the vertebral artery origin, from the subclavian artery to the area entrance in the foramen transversarium, C6. C7 में तो जाती नहीं है. C6. Segment 2 is within foramen transversarium up to C2 vertebra, from C6 to C2 vertebra, and V3 is from C2 to dural penetration, and V4 is intradural corsovertebral artery. This is very important in this particular area. Now, because there are neurosurgical students also, or MCS students sitting here, I have tried to show something about the microanatomy of the vertebral artery near C1 area. C1 area, from where it comes out of foramen transversarium and enters intracranially. Why it is important? Not to injure. Why we are discussing this topic? Not to injure any structure, whether it is artery, vein, nerve, spinal cord, or even bony structures. So, I will try to explain when vertebral artery comes out of transverse foramen of C2 vertebra के foramen transversarium से when it comes out, it goes laterally, and then it enters foramen transversarium of C1. Why it goes laterally? You try to understand. Why it goes laterally? Because the foramen transversarium of the C1 is slightly laterally placed as compared to foramen transversarium of C2. So it has to go laterally. When it goes laterally, here we have tried to show. Then it comes out of foramen transversal C1 and it takes a bend sharp bend over the across a groove on the upper surface of C1 before it penetrates the dura. So there is a groove on the upper of posterior arch of C1 before it enters the dura. Look here. When we operate upon cervical area or cranial-cervical junction, we place an incision here at the back, in the middle. Yes, for the students, look here. From the midline means this is the spine of C2, we have tried to show. From the midline, the distance of the vertebral artery or foramen transversarium on one side is 12 millimeter. Right, up to C2. And when it comes out from the C1 transversarium foramina and enters the area between this foramen magnum and C1 into the cranial cavity, then this area, this Area's distance is approximately 8 millimeter. So we have to be very careful while doing dissection. Surgeon must keep it in mind कि इस एरिया में मेरे को 8 मिलीमीटर के आगे इस साइड में नहीं जाना, अदरवाइज वी मे इंजर द आर्टरी. So this we just there are so many complications if we injure the artery. Whatever venous plexus, I will not go into details. Why CV junction and not me is important. This I have explained in parts. It is important not to cause any kind of damage to any kind of the structure, so that we come out with a good result. Various